Welcome to our channel today. We're delving into the realm of better sleep through cognitive behavior therapy. If you've been struggling with sleepless nights or want to enhance your sleep quality, you are in the right place. Sleep difficulties are an extremely prevalent health problem, with about 33% to 50% of adults reporting regular difficulty falling asleep or staying asleep. About 7% to 18% of adults meet the criteria for an insomnia disorder. Sleep disruptions contribute to a variety of medical problems, including cognitive impairment, reduced immune function, metabolic imbalance, and exacerbation of psychiatric conditions. The long-term improvements seem to result from the patient learning how to support and promote the body's natural sleep mechanism. Sleep difficulties are an extremely prevalent health problem, with about 33% to 50% of adults reporting regular difficulty falling asleep or staying asleep. About 7% to 18% of adults meet the criteria for an insomnia disorder. 12 sleep disruptions contribute to a variety of medical problems, including cognitive impairment, reduced immune function, metabolic imbalance, and exacerbation of psychiatric conditions. Although sleep medication can be an effective short-term treatment for insomnia, some patients experience side effects such as amnestic episodes, cognitive impairment, and morning hangover. In addition, some patients continue to experience sleep disturbance even when they are taking these medications, leading to higher doses and eventual dependence on and tolerance to the drugs. The most effective non-pharmacological treatment for chronic insomnia is cognitive behavioral therapy for insomnia. A 2015 meta-analysis of 20 randomized controlled studies of patients with chronic insomnia found average reductions of 19 minutes in sleep latency and 26 minutes in time awake after sleep onset. Total sleep time improved by 8 minutes, and sleep efficiency improved by 10%. Blessed with a lively intellect and robust energy, tended to face challenges head-on with active problem solving. Unfortunately, she had trouble turning off her natural tendency at night. When she got into bed at night, her mind raced, and it typically took hours to get to sleep. When she presented for treatment, her goal was to improve her sleep and wean herself from the lorazepam, zolpidem, and Zaleplon she was taking every night. She was also taking citalopram, which she planned to continue taking. She needed to be sharp and alert at her job, and she was concerned that her insomnia and the potential side effects of her sleep medications could impair her cognitive abilities. She was highly motivated and had the mindset to work diligently to achieve her goals. At the conclusion of my evaluation, I suggested to Jill that she could improve her sleep and eliminate her sleep medications through. She was enthusiastic about implementing. Its systematic step-by-step framework appealed to her analytical intellect and work ethic. I told her it would neither be a quick fix nor a magic pill, but that it would likely improve her sleep substantially, and she would learn sleep-enhancing skills she could use for the rest of her life. Sleep consolidation, also known as sleep restriction. Many insomniacs spend hours in bed struggling to get to sleep. As a result, they worry about whether they will get to sleep, stay asleep, and, if they awaken, get back to sleep. They try to get more precious sleep by going to bed earlier and staying in bed later, which often makes matters worse. They end up spending even more time awake in bed, struggling to get to sleep. Sleep consolidation reverses this process by limiting the amount of time the patient spends in bed. As a result of staying awake longer, the patient's sleep drive builds up, and when she gets into bed, she is able to fall asleep easily and stay asleep. Techniques that quiet the mind and relax the body help the insomniac to let go and ease into sleep. Slow, deep breathing and progressive relaxation help quiet the nervous system and create conditions conducive to sleep. Mindfulness practices, including mindfulness meditation, help patients learn to observe their thoughts dispassionately. This skill is extremely helpful for quieting the mind, calming emotional reactivity, and setting the stage for sleep. During one of our sessions, I taught a relaxation technique using biofeedback. She was able to see in real time how changing her breathing and quieting her mind transformed her heart rhythm, which she found very soothing. She purchased a portable heart rate variability biofeedback device, which she used to relax for 1 minute several times a day and for 10 minutes every evening as part of her press-sleep routine. Patients often experience sleep deprivation during the first few days, of which quickly resolves once their body adjusts to a consistent, carefully titrated sleep schedule. In fact, that sleep deprivation and corresponding increase in sleep drive is one of the primary factors that accounts for sleep effectiveness. Increased sleepiness at bedtime helps patients get to sleep more easily and stay asleep more soundly. They become more confident about their ability to fall asleep and stay asleep. This growing confidence creates a self-fulfilling prophecy that helps promote healthy sleep. At the outset of Jael's treatment, she and I communicated with her primary care physician, who developed a detailed plan by which Jael would be weaned from her sleep medications. I explained to Jael that generally takes 6 to 8 weeks to fully implement. In her case, because she would be weaning off her medications gradually, the process would likely take longer. Jael began the process by keeping a sleep log for 1 week detailing when she went to sleep, how long it took her to fall asleep, how much time she spent awake during the night, and what time she got out of bed in the morning. Based on that 1 week of data, we calculated the average amount of time she slept per night, which was 7 hours and 25 minutes. We arranged for her to have a nightly sleep window of 7 hours and 30 minutes, with a bedtime of 11:30 p.m. and a wake-up time of 7 o'clock a.m. She was instructed to avoid sleeping in on the weekend. Her sleep ritual began at 10 to 10:30 p.m. and included turning down the lights in her apartment, taking a hot bath, using a lavender diffuser, using biofeedback-assisted relaxation for 10 minutes, and watching mindless TV for 20 to 30 minutes. Her new rescue dog, who slept in her bed, also helped her to calm down to sleep. Over the next few weeks, Jael's sleep gradually improved, and she no longer worried about her ability to get to sleep. After 4 weeks, she told me, "Sleep is no longer a battlefield. A few weeks ago, I didn't think it could happen." After 6 weeks, she stated, "During the day, I wasn't worried about not being able to sleep at night." At the time of her final session, she was falling asleep easily and sleeping soundly through the night, without any sleep medication. If she did wake up during the night, she got back to sleep easily. She summarized her new experience of sleep this way: "It's easy to fall asleep, and I have no anxiety about not sleeping. My body gets signals it's time to sleep, and I'm confident about sleep now." She also shared that her newfound ability to let go, which was such an important aspect of being able to fall asleep, had generalized to other parts of her life. She was feeling much calmer and stopped obsessing about things outside of her control in relation to work, relationships, and her daily activities. That wraps up our journey into cognitive behavior therapy for sleep. If you found this information helpful, don't forget to give us a thumbs up, subscribe our channel. Thanks for watching.